So in this scan, I really wanted to focus on the carotid artery and move up towards the carotid sinus. And I thought it would be helpful to have a netter image just to reference kind of where we are. So I'm going to start, you can see the thyroid right here. This is my right. This is more medial, lateral. This is my right carotid artery. So we're right about here. And this is the donor patient's right carotid artery. So I have the probe kind of sitting just like this. So the indicator's towards my right, but it's also kind of pointing posterior a little bit. And that'll be helpful when we go to differentiate between these two, because as we slide up and this indicator stays on this side, the internal carotid will stay on this side of the image. So I'll stay in the short axis and slide up till we meet that bifurcation right there. Okay, so internal carotid, you can see that big swelling. So there's your carotid sinus, external carotid, and there's a hypoechoic structure between the two. And if we look right here, I can see that that's the carotid body. Now, I'm going to move into the long axis, and I'm going to stay focused on this internal carotid, and I'll just spin the indicator up towards my head, so this will be superior and this will be inferior. So you can see that swelling right here. So there's your carotid body, or carotid sinus, excuse me. And move back to the short axis.